inorganic compounds like copper sulfate, sodium potassium tartrate. Then later part we will discuss about different emetonics like ferrous sulfate, ferrous gluconate. So the role of emetonics is to maintain the hemoglobin or blood levels in our body by supplying different iron supplements. Later we will discuss about the poison and antidote. So the poison that produce different harmful effects in our body. For these poison, different types of antidotes are available. These antidotes neutralize the role of poison or or they interrupt the effect of different poison. So these include sodium thiosulfate, activated charcoal, sodium nitrite, and later we will discuss about astringents. So these are the topical agents and which include zinc sulfate and potash alum. So before starting the expectorant, firstly I will discuss the respiratory system. So the function of the human respiratory system is to transport air into the lungs and to facilitate the diffusion of oxygen into the bloodstream. So the respiratory system has the important role in our body and they transport the air into the lungs. And the lungs, which play an important role in purifying the air. So the respiratory system is very important role having in our body. It also received waste carbon dioxide from the blood and exhales it. So it received the carbon dioxide from alveoli and that exhales through trachea. So this is the uh, whole respiratory system, which include nasal cavity, oral cavity. So the major amount of respiration that occur through nasal cavity and nasal cavity having different type of cilia that interrupt the entry of different particles through nose and that clear the air that entry for the trachea. And the second one is oral cavity. Oral cavity generally taken air during the hard workout or exercise and a lot of amount air can be entered through oral cavity. Then it enters into pharynx, then epiglottis, then it goes through larynx, that is also called voice box, and then trachea, that is called windpipe, and then air entered into the lungs. So the lungs that have different bronchial tree. So these bronchial tree divided into bronchioles and they divided into primary, secondary, tertiary bronchioles and finally they uh, divided into alveoli or these alveoli having different alveolar sacs. So the anatomy of airway and how oxygen gets into the blood. So the respiratory system organs are separated uh, into upper and lower respiratory tract. So the upper and lower respiratory tract having different organs. The upper respiratory tract include the mouth, nose, nasal cavity, pharynx, and larynx, that is called voice box, and These all have a specific function to add the flow of air into the body. So the upper respiratory tract organs include mouth, nose, and nasal cavity. So the function of this part of the system is to warm, filter, and moisten the incoming air. Then pharynx, here the throat divided into the trachea, that is windpipe, and esophagus, that is food pipe. So there is a small flap of cartilage is also available, that is epiglottis, which prevent food from entering into the trachea. So epiglottis make a barrier for the entry of food into the trachea. So pharynx play an important role, and that connected the oral cavity to larynx. Next one is larynx. So this is also known as voice box, where the sound is generated. So when ears come into the contact of larynx, then their different vibration occurs and they responsible for the sounds. So it also helps the protect the trachea by producing a strong cup reflex. So because it is the upper part of trachea, so it protect the trachea for producing a strong cup reflex. If any solid object passes the epiglottis, if any solid object passes to epiglottis, then the larynx play a strong role, important role for protecting the trachea. And the lower respiratory tract organ, so that is trachea. So trachea, that is known as windpipe. This is a tube that carries air from the throat into the lungs, and it ranges from 20 to 25 millimeter in diameter and 10 to 16 centimeter in length. So trachea that connect the larynx to the lungs. So the inner membrane of the trachea is covered in tiny hairs called cilia, which catch particles of dust which we can then remove through coughing. So whenever coughing occur, then these tiny hairs which catch particles of dust and remove it. So the trachea is surrounded by 15 to 20 C-shaped rings of cartilage at the front and side, which help protect the trachea and keep it open. So trachea is not ring shaped, it is C shaped. And behind this trachea, their esophagus have found. So these due to this esophagus, because it is generally present in collapsed form, and whenever we take food, then it shows peristalsis movement. So they expand, and uh, this C-shaped can easily expand the esophagus. So trachea having C-shaped and surrounded by 15 to 20 C-shaped rings of cartilage. Then they are not complete circles due to the position of the esophagus, as already I told, and that esophagus immediately behind the trachea, and the need for the trachea to partially collapse to allow the expansion of the esophagus when swallowing large pieces of food. So whenever we swallow a large amount of food, then the esophagus can easily expand due to this C shape of trachea. So that is all about lower respiratory tract organ or trachea. Then trachea further divided into bronchi. The trachea divided into two tubes called bronchi, one entering the left and one entering the right lung. The left bronchi is narrower, longer, and more horizontal than the right. Irregular rings of cartilage surrounded the bronchi. So the trachea divided into two bronchi. One is entered into left and one entered into right lung. So here the left bronchi is narrower, longer, and more horizontal. Okay, and some irregular rings of cartilage surrounded the bronchi, whose walls also consist of smooth muscles. So these walls contain smooth muscles. Once inside the lung, the bronchi split several ways, forming tertiary bronchi. So when trachea entered into the lungs and divided into bronchi, then these bronchi further branched into primary, secondary, or tertiary bronchi. So bronchioles, tertiary bronchi continue to divide and becomes bronchioles. So these tertiary bronchi further divide and converted into bronchioles. That is very narrow tubes, less than 1 millimeter in diameter. So bronchioles is very narrow tubes and have 1 millimeter in diameter. There is no cartilage within the bronchioles and they lead to alveolar sacs. So bronchi which having a cartilage but bronchioles does not have any type of cartilage. Then these bronchioles further divided into alveoli. Alveoli, individual hollow cavities contained within alveolar sacs. So the lungs having different alveolar sacs and which consist alveoli. So alveoli have very thin walls which permit the exchange of gases, oxygen and carbon dioxide. So in lungs, the main process, the exchange of oxygen or carbon dioxide occur at alveoli. Okay, so alveoli play an important role in exchange of gases. They are surrounded by a network of capillaries. So near the alveoli further connected with different capillaries and these capillaries connected with the heart. So into which the inspired gases passes. So here the purification process occurs and the CO2 or impure gas that transferred towards lungs and the pure gas that transferred oxygen gas that transferred into the blood and these oxygenated blood further pass into the heart and transfer into the whole body. So this is the main process that actually alveoli work. There are approximately 3 million alveoli within an average adult lung, and these have a and these having 3 million alveoli in the lungs. So there is a lot of oxygen or oxygenated gas transferred into the blood. Diaphragm. The diaphragm is a broadband of muscle which sits underneath the lungs. So diaphragm occurs underneath the lungs and attaching to the lower ribs, sternum, and lumbar spine and forming the base of thoracic cavity. So diaphragm having a role in dilation or constriction form and they are also responsible for expansion and contraction of lungs. So these are the body parts of respiratory system. You can see nasal cavity, pharynx, larynx, trachea, bronchi, bronchioles, and diaphragm. So mechanism of breathing inspiration. So when you breathe in, the air comes from nasal cavity, larynx, pharynx, and enter into the lungs. Here, the intercostal muscles pulls ribs up and out. So when the intercostal muscles pull the ribs up and out, the intercostal muscles between the ribs contract and pulling the chest wall up and out. So what actually happened? The ribs contract and pulling the chest wall up and out. The diaphragm muscle below the lungs contract and flatten. So this is the process of inspiration. So here the ribs contract and pulling the chest wall up and out, and diaphragm muscle below the lungs contract and flatten, and increasing the size of chest. The lungs increases in size, so the pressure inside them fall. This causes air to rush in through the nose or mouth. Diaphragm contracts and move down. This is the whole process. The intercostal muscles pulls ribs up and out, and you can see the diaphragm contracts and move down, and the lungs expand and air entered into the lungs. Okay, so this is the mechanism of breathing. इंस्पिरेशन में क्या हो रहा है कि इंटरकॉस्टल मसल्स जो क्या हो रही हैं, रिब्स कॉन्ट्रैक्ट हो रही हैं और पुलिंग द चेस्ट वॉल्स अप एंड आउट. नेक्स्ट इज expiration. So when you breathe out, ribs move in and down. So here the intercostal muscles between the ribs relax. So here the muscles relax. In inspiration, their muscles contract. Here muscles relax, so that the chest wall move in and down. So here the diaphragm muscle below the lungs relax and bulge up. So here the reducing the size of chest. Why? Because the diaphragm muscle relaxes and they move upward side of chest. So here the chest uh, produce pressure, and the chest size will reduce. The lungs decreases in size, so the pressure inside increases, and air is pushed up the trachea and out through the nose or mouth. So here the diaphragm relax and bulge up. So this is the process of expiration. Here ribs move in and down, and diaphragm relax and bulges up. So finally the lungs contract. So this is the whole process of inspiration and expiration. So here the inward bulk flow of air occur, and in inhalation the diaphragm contracts and moves down, and you can see the both picture of inhalation and exhalation. So here clearly you can see during the inhalation diaphragm contracts and moves down. The external intercostal muscle contract and lift the rib cage upward. So lift the rib cage upward and outward direction. So the lungs volume expands. But in exhalation process, the diaphragm and intercostal muscles return to the resting position. So when they comes into the resting position, then the ribs cage moves down and the lungs recoil passively. So here the lungs contract and reduce in their size, and the air will exhale. So outward bulk flow of air occur here. This is nasal mucosa. So when air comes through nasal mucosa here, the nasal mucosa consists different part in which first is basement membrane, second nucleus of columnar epithelial cell, then goblet cell, and that connected with different cilia, and these goblet cells secrete mucus, and that comes into contact of the cilia. Here, the watery saline layer allows cilia to push mucus towards pharynx, and mucus layer traps inhaled particles. So that mucus showing very important role because it interrupt the different particles that inhaled through nose, and cilia moves mucus to the pharynx. So the mucus moves through this nasal mucosa to pharynx, and it's so an important role to trap the inhaled particles. And next is respiratory system. So when the air comes through nose or mouth, then it goes through larynx, pharynx, then trachea, and entered into the bronchiole. So here, as we discussed, the trachea divided into bronchiole, and these bronchioles, uh, about 20 divisions found in secondary bronchioles. Then they further divided into tertiary bronchiole. Then they further divided into conducting bronchioles. So in conducting bronchioles, there is no gases exchange occur. Okay, so the conducting bronchioles do not participate in any gaseous exchange. But this conducting bronchioles further divided into respiratory bronchioles. So this respiratory bronchioles generally having 3 to 5 divisions, and they having thin membrane gas exchange. So here the gaseous exchange occur, but that is in very little amount. Okay, so the respiratory bronchioles also play an important role in gaseous exchange, but it is not enough for exchange of total oxygenated air. So these respiratory bronchioles further divided into alveoli. Alveoli having sac-like structure, and these sac-like structures show important role in gaseous exchange, and the main oxygenated blood transferred through this alveoli, and the deoxygenated blood further that transfers CO2 through this alveoli and exhale this oxygen, this CO2 to trachea. So this is all about respiratory system, and here we have discussed what is the role of different parts of respiratory system, and how the gases exchange occur, and how oxygenated blood comes into the blood, and how these blood transferred into whole body, and deoxygenated blood which consists CO2 that exchange into alveoli and further exhale from the lungs. Next is regulation of respiration. So as we can see in this figure that there are different regulatory possible higher brain centers that cerebral cortex or voluntary control over breathing. So higher brain centers, they control the respiration and it generally control the voluntary of breathing. So they have a voluntary control over breathing. Second is respiratory center, that is medulla and pons. So they also control different voluntary and involuntary control over respiration. Then next is stretch receptor, that is found in lungs, and these stretch receptor when in contacts with different irritants then also responsible for controlling of this respiratory system. Then irritant receptors found in trachea that also control the respiratory centers. Other receptors like pain, emotional stimuli that acting through the hypothalamus and regulate the respiratory system. So whenever we feel different type of emotions and any type of pain, they also control the hypothalamus and they the hypothalamus control the respiratory system. Some peripheral chemoreceptors are also present and these peripheral chemoreceptor also control the respiratory system. So these peripheral chemoreceptors generally induce why the decrease in oxygen and increase in CO2 or increase in hydrogen ion concentration. So these peripheral chemoreceptors also regulate the respiration. Furthermore, some central chemoreceptors, these central chemoreceptors which activate due to increase in CO2 and hydrogen ion concentration also regulate the respiration. Furthermore, some receptors in muscles and joints are also responsible for control in respiration. So this is the whole things related to regulation of respiration. So higher brain centers, respiratory centers that include medulla and pons, stretch receptors, irritant receptors, receptors in muscles and joints, central chemoreceptors, peripheral chemoreceptors, and pain and emotional stimuli that acting through hypothalamus, all these control the respiration. The respiratory centers. So the involuntary respiration is controlled by the respiratory center of the upper brain stem. That is also called the lower brain along with cerebellum. The region of the brain control many involuntary and metabolic functions besides the respiratory system. So the region of the brain control many involuntary and metabolic functions beside the respiratory system. So these regions also control different type of involuntary and metabolic functions. So including certain aspects of cardiovascular functions and involuntary muscle movements in the cerebellum. So they also control different cardiovascular functions. The respiratory centers contain chemoreceptors that detect pH level in the blood. So the respiratory center also having different type of chemoreceptors and these chemoreceptors related to change in pH. So whenever the pH level in the blood increase, they induce. So that detect pH level in the blood and send signal to the respiratory center of the brain to adjust the ventilation rate, to change acidity by increasing or decreasing the removal of carbon dioxide. So they control the removal of carbon dioxide. So these respiratory center so an important role in controlling the carbon dioxide removal. So these respiratory centers are generally detect the pH levels in blood, and when they detect the pH level, then they send the signals to the respiratory center of the brain, and then they adjust the ventilation rate. So how much oxygen needed or carbon dioxide need to exhale. So they decided. There are also peripheral chemoreceptors in other blood vessels that perform this function as well, which include aortic and carotid bodies. So aortic and carotid bodies are also having different type of chemoreceptors, and they responsible for involuntary respiration. They show important role in regulation of involuntary respiration. So the first one, the as we discussed, the respiratory centers, medulla and pons. So the medulla oblongata is the primary respiratory control center. Its main function is to send signal to the muscles that control respiration. Okay, so medulla oblongata क्या कर रही है? The primary respiratory control center, and its main function is to send signal to the muscles. So they send signal to the muscle, and these muscles control the respiration process. As we discussed, intercostal muscle. So when these intercostal muscle contract, then the lungs expand in their size, and when these intercostal muscles relax, then the lungs contract inside, and exhalation process occur. And when intercostal muscle contract, then inhalation process occur. So these medulla oblongata is control the respiration. So there are two regions in medulla that control the respiration. So first one is the ventral respiratory group. The ventral respiratory group stimulates expiratory movement. So they're responsible for expiration. And the dorsal respiratory group stimulate inspiratory movement. So inspiration occur due to dorsal respiratory group. So they divided into two groups. First one is ventral and second one is dorsal. So ventral respiratory group stimulate expiration, and inspiration generally stimulates by dorsal. The medulla also controls the reflexes for non-respiratory air movement. So medulla oblongata also control the reflexes of non-respiratory air movement, such as coughing, sneezing reflexes, as well other reflexes like swallowing and vomiting. So medulla oblongata also controlling the non-respiratory air movement, and these non-respiratory air movement related to coughing, sneezing reflexes, as well as swallowing and vomiting. Okay, so these all controlled by medulla oblongata, and this medulla oblongata is the primary respiratory control center. Second is the pons. So the pons is the other respiratory center and is located underneath the medulla. So this is found underneath the medulla, and its main function is to control the rate or speed of involuntary respiration. So it control the rate or speed. And medulla, what they control? They control these signals. So they control the muscles contraction, relaxation, and it control and pons control the rate of speed of involuntary respiration. So it has two main functional regions that perform this role. First is apneustic center, and second one is pneumotaxic center. So first is apneustic center. So apneustic center sends signal for inspiration for lung and deep breath. So it is responsible for inspiration and expansion of lungs or deep breath. It controls the intensity of breathing. So the apneustic center also control the intensity of breathing, how much you can inhale the air inside the lung. It controlled by pons and is inhibited by the stretch receptor of pulmonary muscle. So when the maximum amount of air inhaled, then it is inhibited by the stretch receptor of pulmonary muscle at maximum depth of inspiration. Okay, or by signals from the pneumotaxic center. So whenever the breathing is completed and lungs expand in their maximum side, then the signals from pneumotaxic centers comes and they responsible for contraction of this lungs and it increases tidal volume. So apneustic center also increase the total air volume or tidal volume of lung. The pneumotaxic center sends signal to inhibit inspiration that allows it to finally control the respiration rate. So pneumotaxic center, what they are doing, they send signals to inhibit inspiration that allows it to finally control the respiration rate. So they control the respiration rate. Its signals limit the activity of the phrenic nerve. So it's also control the activity of phrenic nerve and inhibit the signals of the apneustic center. So its signal also limit the activity of phrenic nerve and also inhibit the signal of apneustic center and it decreases the tidal volume. So apneustic center, they responsible for increase the tidal volume. The tidal volume is total volume of air inside the lung. And the pneumotaxic center, what they doing? They decrease the total tidal volume or the air when exhale from the lungs. So it decrease total tidal volume. So the pons play an important role as a respiratory center and with medulla it's so the controlling of respiration. Voluntary respiration. So voluntary respiration is any type of respiration that is under conscious control. So uh, every controlling that under conscious control that included under voluntary respiration. So voluntary respiration is important for the higher functions that involve air supply such as voice control. So these are all are voluntary respiration. Voluntary respirations functions are controlled by the upper brain, namely parts of cerebral cortex. So cerebral cortex control the voluntary respiration. Involuntary respiration are controlled by lower brain. So all the involuntary movement that are under lower brain controlling. The motor cortex. So the primary motor cortex is the neural center for the voluntary respiration control. More broadly, the motor cortex. So motor cortex is responsible for initiating any voluntary muscle movement. Okay, so motor cortex uh, responsible for initiating any voluntary muscle movements. So all the voluntary muscle movements controlled by motor cortex during period of perceived danger or emotional stress. So whenever we feel danger or emotional stress, then what happens? The signal from the hypothalamus takes over the respiratory signal, and increases the respiratory rate. So these motor cortex, what they doing? They send the signal to the respiratory center, and the respiratory rate will increase, that facilitate the fight or flight response. So whenever uh, we we feel any type of danger or emotional stress, then the hypothalamus activated, and that increase the respiration rate. Okay, so these all are under motor cortex. Symptoms of respiratory disease. So there are various symptoms of respiratory disease, in which first is include sputum and second cough. So sputum, it gives up when normal mucociliary clearance mechanisms are overloaded by excessive mucus production. So it gives up a cup sputum when it produces, then when normal mucociliary clearance mechanism activated. So sputum induces. Cough, it is a part of natural defense mechanism. So cough, it is a part of natural defense mechanism for clearing air passes of foreign material and excess mucus. So whenever excess mucus that generated inside the lungs, then the or any particles that entered through nose, then then cough, in the form of cough, they remove and clear the air passes. So we do not feel any type of obstruction in air inhalation and exhalation. So cough so an important role in defense mechanism, okay, for clearing air passes of foreign materials and excess mucus. Breathlessness, so it is an unpleasant awareness about the sensation of breathing. So unpleasant awareness about the sensation of breathing is called breathlessness. Then wheezing, when intrathoracic airways are narrowed. Intrathoracic airway are narrowed. When then what happened? Further reduction in airway caliber during expiration result in airway closure. So that is called wheezing. Chest pain due to infection, inflammation, malignant involvement of parietal fluid. So these all symptoms of respiratory disease. Furthermore, infection or irritation of the airways triggers them to inflame, narrow, and secrete thick mucus. So whenever any infection occur in ear passage, then the inflammation produce, and that is responsible for narrower of different airway, and that is also responsible for secretion of thick mucus, that is also called phlegm. This clogs the small airway, and that is responsible for choking of airway, and we cannot easily inhale or exhale the air. That causes the characteristic cough of bronchitis. So bronchitis, generally known as the choking of airway, wheezing, shortness of breath. So these all related to cough. The cough may produce sputum. So cough also produce sputum, which is plasma cup up from the lungs. This is known as a productive cough. and is an attempt by the body to clear mucus that is clogging the airways. So whenever any external material that entered any particles or any inflammation occurs in lungs, then the productive cough produce, and that show a protective mechanism uh, and removing of other particles through the airways. So that all about the respiration and different type of diseases that involved in respiration that related to respiration. Now comes uh, on the topic expectorants. So what is expectorant? So, what is the work of expectorant? Expectorants are the drug that help in removing sputum from the respiratory tract. So, expectorant doing very important role in removing sputum from the respiratory tract, either by increasing the fluidity or reducing the viscosity of the sputum. So, the sputum that clogging the airway, and that may be response of very inflammation or any type of irregular activities of airway, and these sputum can be uh, treated by expectorants. So expectorants is not decrease the amount of production of any type of sputum or any type of mucus, but they increase the fluidity. So they increase the fluidity and reduce the viscosity. So when these mucus having uh, higher viscosity, then uh, they also clog the airway. And when this mucus remain for prolonged time, then they can produce different type of uh, COPD diseases. So that also responsible for different type of infections. So expectorants uh, work by increasing the fluidity of sputum or reducing the viscosity. Okay, so they also increase the volume of fluids that have to be expelled from the respiratory tract while coughing. So expectorant also responsible for the increasing the volume of fluids. So they increase the volume of fluid or reduce the viscosity of sputum. Okay, an expectorant is a medication that people can use when they have a cough that produce mucus. So any type of cough that produce mucus, that can be treated by the use of expectorant. Doctors and pharmacists refers to this type of cough as productive or wet cough. So these are productive or wet cough. But when it become dry, so they remain in the uh, in the lungs, and when it remains for prolonged time, then they can induce different type of diseases. So expectorants reduce the thickness of mucus and make secretion in the airway thinner by loosening up the mucus in these ways. Expectorant make it easier for a person to cough up flesh and clear out their throat. So their main role is to clear the airway and treat the throat, so we can easily inhale and exhale. So expectorant, what is the main work of expectorant? Is to reduce the thickness of mucus. So expectorants aim to make coughing up mucus easier. They do not actually stop coughing. they never stop the coughing, but they make easier to liquidify or reduce the viscosity. So they exhale the cup, but never they stop the formation of cup. So this is important because a productive cup should not be suppressed because it is the body's way of removing excess mucus. Because productive cup is essential for our body because many particles that enter through nose or we need to exhale from the airway, then cup show an important role for removing of these particles or microorganisms from the airway. So uh, the cup never be suppressed, and productive cup is essential for removing these particles and microorganisms. So expectorants also helps to relieve chest congestion that occurs because of cold, flu, and allergies. So they also relieve the chest congestion that generally occur during any type of cold, flu, or allergies. Rofencin is the commonly used expectorant and treatment of chest tubate, productive or plasmic cuffs. So rofencin generally used, which typically occur with a cold. So any type of productive cough can be treated by the using of this drug, guaifenesin. Potassium iodide has been used to increase the water content of secretions and improve breathing in people with conditions such as asthma, chronic bronchitis, emphysema. So, all these diseases can be treated by the using of potassium iodide. So, what is the work of potassium iodide? Increase the water content of secretion and improve breathing. ओके सो पोटेशियम आयोडाइड को हम यूज कर सकते हैं इन ऑल डिसीजेस व्हाई बिकॉज दे इंक्रीज द वाटर कंटेंट ऑफ secretions. So and when the mucus become liquidify, so easily can be removed or exhale from the body, but when it is found in thick form, then it cannot be easily removed. Okay, so potassium iodide act as a expectorant and used in various diseases related to obstruction of airways. Research has shown that expectorants are not as effective as mucolytics when used to certain respiratory conditions such as COPD. So, some diseases, expectorants are not given because they are very drastic and due to thickness of due to when the thickness and the dry cuff remain for prolonged time, then they are responsible for different type of diseases and it cannot be easily treated by only using expectorants. So here we also use different type of other medicaments. So cuff is protective reflex. What is cuff? Cuff is a protective reflex. Its purpose being expulsion of respiratory secretions. So what is cuff? Cuff is a protective reflex. And what is the purpose of it? So it generally used for expulsion of respiratory secretion or foreign particles from the lungs. So they protect the lungs. And whenever any foreign particles enter into the lungs, then the cuff automatically generate and that exhale the foreign particles from the lungs. So they used they removed these particles from upper airway passages. Cup may be useful, means that it's protective cup. Sputum is cupped up, drain the airway. So cup may be useful or useless. Useless means non-productive or dry cup. So cup may be useful, that related to productive. Sputum is cupped up and drain the airway. And whenever it is useless, then it also responsible for different type of diseases, because in the dry form it still remain inside the body and it cannot exhale from the oral cavity or through nose, and it can generate different microorganisms or inflammation of lungs. And when this inflammation increased in lungs, then we need different types of other treatment. So the productive cough is with productive cough is useful, but dry cough is very dangerous for our body. That is non-productive cough. Useless cough should be separate. So that is dry cough or useless cough, that need to be separate, because when this dry cough still remain in lungs, then it can be inflamed the lining of lungs and different mucous membrane, and responsible for different type of infection, and that cannot be easily treated. A cough is a sudden expulsion of air through the large breathing passage that can help clear them of fluids, irritants, foreign particles, and microbes. So, what is the role of that? Is a reflux action. When any foreign particles entered through breathing, then what is the role of cough? They clear them of they clear them by uh, they clear them fluids, irritants, foreign particles by exhalation. As a protective reflex, cupping can be repetitive with the cup reflex following three phases. So first one is an inhalation, a forced exhalation against a closed glottitis, and a violent release of air from the lungs following opening of glottis. So usually accompanied by distinctive sound. So as a protective reflex, cupping can be repetitive. Okay, with the cup reflex that generally found in three phases, in which first is an inhalation. So when we inhale air, uh, then uh, any particles that entered through this inhalation process, then the reflex action produce a forced exhalation. Okay, so a forced exhalation against a closed glottis. So whenever this process occur, then the protective reflex already activated, and that induce the cough, and a violent release of air from the lungs. So, violent release of air, when we exhale a lot of amount of air through lungs, then the cough is automatically generated, because it is a protective reflex. So, in these all conditions, cough automatically generated by producing different type of sounds. So frequent coughing usually indicates the presence of disease. So when we feel different type of frequent again and again, frequently we coughing, then that indicate the presence of disease. Many viruses, bacteria that that from an evolutionary perspective by causing the host to cough, which help to spread the disease to new host. So when these coughs generated different virus bacteria, so these also excel into air and they can spread disease to another person. So frequent cough may be responsible for different type of diseases. Most of time, irregular coughing is caused by a respiratory tract infection. So most of time, what happen? Irregular coughing is caused by a respiratory tract infection, but can also be triggered by choking, smoking, air pollution, asthma, gastroesophageal reflux, post-nasal drip, chronic bronchitis, lung tumors, heart failure, and medications such as angiotensin converting enzyme inhibitors. So, irregular cough that is caused by different respiratory tract infection. But this irregular coughing also triggered by different type of factors in which I have discussed that choking, smoking, air pollution, asthma, gastro gastroesophageal reflux disease, post-nasal drip. So all these parameters triggered the respiratory tract infection and irregular coughing. So treatment should target the cause. So whenever we uh, feel irregular coughing or frequent coughing, then that should need to treat. So the treatment should target the cause like smoking cessation or discontinuing ACE inhibitors. So when we stop the smoking or discontinuing the AC inhibitor, then it can be treated to production of cough. So, what is the cause of production of cough? That uh, if we know what is the cause, then can it easily be treated. So, cough suppressants such as codeine or dextromethorphan are frequently prescribed. So some cough suppressants are also available, and that include codeine, dextromethorphan. So these prescribed for the treatment of irregular cough. Other treatment option may target airway inflammation or may promote mucus expectoration. So there are some other treatment option available. So they include the treatment of inflammation that produced by cough or dry cough or promote mucus expectoration. So as it is a natural protective reflex, suppressing the cough reflex might have damaging effect. So especially if the cough is non-productive. So the cup is a protective reflex, and suppressing the cup reflex also may be produce a dangerous effect. So uh, if we change the natural process of our body, so they also having a different type of other effects because we if we change natural cup reflex process and uh, when any particles or any microbes enter into the body and our cup reflex disturb, then we can easily contaminated by microorganisms or maybe generated different type of diseases. So, what are the triggers that induce cough, which include viruses, allergies, and asthma, irritants, post-nasal drip, acid reflux. So, these are the triggers that induce cough. So viruses, colds and the flu are the most common causes. So whenever we feel cold, flu that infected in our body, so they're responsible for different type of cough. While annoying coughs that are productive get germy mucus out of your lungs when you are sick. So cough is as we discussed that it is a reflux process, and when we infected by viruses, then our body uh, produce a productive cough because they fight with these germs, and due to this uh, uh, this reflux activity, the mucus generated. So most will go away in a few days. So generally, what will happen when we feel cold or infected by flu, then our body reflex process started, and cough production increase or mucus production increase, and uh, within 2 to 3 days we will okay because they cleared through the airways. After a cold, through some dry coughs last week or month, but some dry coughs when the cough still remain in our body and become dry, then it inflamed the mucous membrane of lungs, and that is responsible for different type of diseases. That could be because coughing irritates your lungs, so cough irritate the lungs, which leads to more coughing. So whenever the dry cough produce inside in our lungs, then they inflamed and uh, irritate the lungs, and which responsible for more coughing, which irritates your lungs, and so on. So this condition become very dangerous and responsible for different infections, allergies and asthma. If you have any type of allergy or you are asthmatic, then uh, inhalation of mold type of allergens cause your lungs to overreact. So sometimes you feel overreaction. Okay, why? Because you are allergic to some substances, and you will come in contact with these allergens, or if you inhaled these allergens, then your body automatically reflects, and the coughing triggered, and more coughing production uh, initiated. So they are trying to cough out what mothering time returns. Even if you are not allergic, if you are not allergic, things like cold air, cigarettes, smoke, or strong perfume can produce it. So irritant also produce the cough. Okay, if you are not allergic, then uh, cold air, cigarette, smoke, or perfumes, they also produce it. Post nasal drip. When you are congested, mucus drips down from your nose into your throat and makes you cough. So whenever you congested, mucus drips down. So through your nose, mucus drips down inside the throat and makes you cough. You can get post-nasal drip from colds, flu, sinus infections, allergies, and other problems. So you can also get post-nasal drip from colds, flu, sinus infection, allergies, and other problems. Acid reflux, so it is also a trigger of cough. So when you have heartburn, what is heartburn? When your heart feeling pain due to different type of reflex action of stomach, and stomach having acidic when you feel acidity or increase acidic environment of stomach, then stomach acid back up into your throat. So stomach acids back into your throat, especially at night. So whenever we lay down, so the our process become relaxed and stomach uh, stomach follow back the acid towards throat, and that is responsible for heartburn. So this condition, acid reflux, they can irritate your windpipe. So this acid reflux irritate windpipe, vocal cords, and throat, and make you cough. Okay, so these all are the triggers that induce cough, in which first include we discussed about viruses, allergies and asthma, some irritants, post nasal drip, acid reflux. So all these responsible for coughing. Next is types of cough. So the classification based on duration, characteristic, quality, and time. So there are different types of cough. In which first is acute, second one is subacute, and third is chronic. So what is acute? That is sudden onset and less than 3 weeks. That include under acute cough. So that is only for few weeks, and it can be treated by different type of medications and expectorants. But subacute, which generally occur for 3 to 8 weeks, and it also be treated by giving different type of drugs. And chronic, that longer than 8 weeks, it is very dangerous and infected a lung and responsible for different diseases. So there are three types of cough. First one acute, subacute, and chronic. And already we discussed that acute is found for less than 3 weeks. Then subacute, that generally occur for 3 to 8 weeks, and chronic, that is longer than 8 weeks. So these are the types of cough. Second is mechanism of cough. So how the cough produce, and what is the controlling of production of this cough. So the firstly stimulation of mechano or chemoreceptor. So we already discussed that mechano or chemoreceptor that occurred in different part of body, that uh, that response that generally found in throat, respiratory passages, or stretch receptor in lungs. Whenever they induce or feel any type of sensation, then they stimulate, and they further responsible for apparent impulses to the cup center, that is medulla. We already discussed that what is the role of medulla, and this medulla control different voluntary movements of airway, and that apparent impulses via parasympathetic and motor nerves to diaphragm. So these apparent impulses further follow the apparent via parasympathetic and motor nerves to the diaphragm, then intercostal muscles and lungs. So what is the role of diaphragm? We already discussed that diaphragm generally flatten when we inhale the air, and contract or goes upward direction when we exhale. So when it contract, the size of lungs increased, and the inhalation process started. And whenever it contract, then exhalation process occur. So it served an important role in respiration. Intercostal muscle that that found in between ribs, and when these intercostal muscles contract, then lung size increased, and when they relax, then lung size decreased. So apparent impulses, you can see in the diagram that there is nucleus ambiguous, trigeminal sensory nucleus that found they uh, they take response from uh, irritants, and they induce the respiratory center, and this respiratory center further connected with diaphragm and lungs and different abdomen muscles. So they produce different type of reflex action, and these reflex action responsible for cupping. Okay, so mechanism of cuff. First is the stimulation of mechano or chemoreceptor that inside the throat, respiratory passage, or stress receptors in lungs. They further connected with afferent impulses to the cup center or medulla that further connected with efferent impulses via parasympathetic and motor nerves to diaphragm, intercostal muscle, and lungs, and that further connected with increased contraction of diaphragmatic, abdominal, and intercostal muscles. So that is responsible for increased contraction. So the force, they increase the force of contraction of diaphragm, abdomen, and intercostal muscles. So noisy expiration or cup produced. So you can understand how the cup is produced and what is the basic behind the production of cup. We already discussed what is the triggers that produce the cup, and we already discussed uh, how many ways the cup can be produced. Now the mechanism of cup, and these all factors or trigger factors, that is irritant or any type of other trigger factors that directly connected to the cup center, medulla, or brainstem. So they efferent impulses are generated. They responsible for generation of efferent impulses uh, via parasympathetic or motor nerves. Okay, so these all finally connected with different parts of the body, and the lungs, diaphragm, intercostal muscle. These all are connected with this respiratory center, and finally they responsible for coughing. So mechanism, in a short way, we can explain that about 2.5 liter of air is inspired. Epiglottis closes, vocal cords shut tightly to entrap the air within the lung. Okay, so about 2.5 liter of air we inspired, and what happened? Epiglottis closes. So epiglottis closes, vocal cords shut tightly to entrap the air within the lungs. So what we called shut tightly. Then abdominal muscles contract forcefully. So now abdominal muscles contract forcefully, pushing against the diaphragm. So they push against the diaphragm. So here we have already discussed what happened. This is the diaphragm. You can see the diaphragm. This one is the diaphragm, and here the intercostal muscles. So what happened? First one is epiglottis closes, vocal cords shut tightly to entrap the air within the lungs. Okay, so here the epiglottis that closes this part, Uh, Vocal cords shut tightly. Okay, so vocal cords also shut and entrap the air within the lungs. So lungs having the air. Now abdominal muscle contract forcefully. Next one, what happened? The abdominal muscle contract. So pushing against the diaphragm. And then internal intercostal muscles also contract forcefully. Pressure in lungs rises to 100 mmHg or more markedly positive in the thoracic pressure causes narrowing of the trachea. Okay, so these all factors responsible for narrowing the trachea. Then vocal cords and epiglottis suddenly open. Okay, so now firstly what happened? The lungs, the inhalation process occur and the lungs consume consist a lot amount of air. Okay, now vocal cords and epiglottis suddenly open. So vocal cords and epiglottis open suddenly and large pressure difference. Firstly, it entrap the loads of amount of air, lungs entrap the load of amount of air, and when the vocal cords and epiglottis suddenly open, then large pressure differential between the airway and the atmosphere coupled with tracheal narrowing produces rapid flow rates through the trachea. So lots amount of air expelled from velocity and uh, it's ranging from 75 to 100 miles per hour. And this exhalation of loads amount of air responsible for coughing. Okay, so we have discussed that 2 liter inspired when loads amount of air we inspired. Then epiglottis closes. Okay, and entrap the air within the lungs. Then what happened? Abdominal muscle also contract and they push against the diaphragm. Then internal intercostal muscle contract forcefully, and then pressure of the lungs arises around 100 mmHg. Okay, so they responsible for positive intrathoracic pressure and narrowing of trachea. Then further what happens? Vocal cords and epiglottis suddenly open and large pressure differential between the airway. Okay, so here you can see the as we discussed that this large difference of pressure uh, between thoracic cavity and atmosphere. Okay, so narrowing produces rapid flow rates through the trachea and air is expelled at velocity and that responsible for coughing. The shearing forces that develop aid in the elimination of mucus and foreign material. So this sharing forces actually that responsible for elimination of mucus and foreign materials. Okay. So drugs for cough can be treated as a symptom or with specific remedies. Okay. So on the basis of these symptoms, you having which type of symptoms. That is the non-specific therapy, and you can also use different type of specific remedies like antibiotics. Non-specific therapy, which include pharyngeal demulgents, lozenges, cup drops, linctus containing syrup, glycerin, liquorice. So these are the different type of therapy. Here we also see the different terms like decongestants. So, what is the role of decongestants? Decongestants help alleviate a blocked nose. Okay, so they feel comfort of blocked nose. So these drugs work by contracting blood vessels in the nasal passages. So those drugs which having demulgents, decongestants property work by contracting blood vessels in the nasal passages. This contraction increases the size of airway. So when the blood vessel contract, then the size of airway increased and allowing people to breathe more easily through their nose. Okay, so what is the purpose of decongestants and how they work? We discussed that they contract the blood vessels in the nasal passages. Phenylephrine and pseudoephedrine, generally used as a decongestants, are the two important decongestants that people may find in OTC, cold and cough medications. Cough suppressant, there are different cough suppressant are also available. Low dose codeine and dextromethorphan are two cough suppressant that people also find in OTC medicines. Demulcent, an agent that forms a soothing protective film when administered onto a mucous membrane surface. So, what is the work of demulcent? The agent produces soothing or protective film uh, when administered onto a mucous membrane surface. So, for example, mucilage and vials are demulcent that can relieve irritation of vial lining. So they produce protective film. Linctus are solutions of one or more medicaments, usually containing large amount of sucrose. So linctus include large amount of sucrose and sometimes glycerine. They used as a sweetening agent and also have a demulcent effect on mucous membrane of throat. So they also produce a demulcent effect on the mucous membrane. Next, expectorants categorize in directly acting. So sodium and potassium citrate or acetate, potassium iodide, guacol, guafencin, balsam of tolu, basaka, and terpene hydrate. These are used as a directly acting expectorants. Second one, further expectorant divided into mucolytics. So some mucolytics like bromhexine, ambroxol, acetylcysteine, carbocysteine, they generally used as mucolytic agents. Furthermore, either from expectorants, some how can we reduce the cough? So because we are studying uh, uh, all about medicaments that treat the cough. So antitussive also play an important role in the cough suppressant action, and they reduce the cup centers. So they actually act on cup centers and suppress the production of cup. So opioids like codeine, codeine, ethyl morphine, morphine, these all includes under opioids. Some non-opioids are also included: noscapine, dextromethorphan, oxyladin, chlorpheniramine, antihistamine are also included as a antitussive agents or cough suppressant action like chlorpheniramine, diphenhydramine, promethazine. So these all are antihistamine and used in cough suppressant action. So, in inorganic chemistry, as we are actually discussing the specific element or compound that have expectorant action. So, according to their mechanism of action, the expectorant are categorized in two parts. First one is sedative expectorant and stimulant expectorant. So, stimulant expectorants increases respiratory tract secretion. So, what is the work of stimulant expectorant? They increases the respiratory tract secretion. Why? A direct effect on the bronchial secretory cells. So, they produce the direct effect on the bronchial secretory cells and increases the secretion. So, what is the main goal behind the expectorant? They liquidify or they decrease the viscosity, so they convert into liquid, and these liquid easily exhale from the trachea. Sedative expectorants act by gastric reflexes stimulation. So generally, sedative expectorant act by gastric reflex stimulation. So we already discussed different type of gastric reflex, how they are controlled by the medulla. So medulla oblongata play an important role in these gastric reflex action, and diaphragm and thoracic cavity also play an important role. So sedative expectorants, uh, these are stomach irritant expectorant. Okay, so as we discussed, they are stomach irritant expectorants, which are able to produce their effect through stimulation of gastric reflexes. So stomach irritant expectorant, uh, they produce their effect through stimulation of gastric reflexes, include bitter drugs like Ipecac, Seneca, Indian squill. So these drugs responsible for this gastric reflexes, stimulation of gastric reflexes. Inorganic compounds like antimony, potassium tartrate, ammonium chloride, sodium citrate, potassium iodide, these all also used as a sedative expectorants. Further stimulant expectorants. So these are the expectorants which bring about a stimulation of the secretory cells of the respiratory tract directly or indirectly. Since these drugs stimulate secretion, more fluid in respiratory tract and sputum is diluted. So they directly act on cough, and they are responsible for liquidification of this cough uh, and reduction of the viscosity of cough. So it includes eucalyptus, lemon, anise. All these are stimulant expectorant. So, what is the mechanism of action? They act upon respiratory tract in two different ways, by decreasing the viscosity of bronchial secretion, and it facilitates its easy removal by coughing. So, they decrease the viscosity of bronchial secretion, and by increasing the amount of respiratory tract fluid. So they act in two directions. First one is facilitate its easy removal by coughing. Okay, and second one by increasing the amount of respiratory tract fluid. Demulcent action is exerted over dry mucous linings. So dry mucous lining uh, actually convert into some liquidified content. They covered by liquidified content or mucus, thus relieving the unproductive cough. In case of dry cough, many of the expectorants act reflexively. So in case of dry cough, what happened? Many of the expectorants acts reflexively by irritating the gastric mucosa, which in turn stimulate the gastric mucosa to produce the respiratory tract secretion. So, in case of dry cough, now we are discussing about dry cough. So, what in the case of dry cough? Expectorants act by reflexively by irritating gastric mucosa. So, they irritate the gastric mucosa. So, this irritation produce stimulate the gastric mucosa. So this gastric mucosa, what is doing? Stimulate, produce the respiratory tract secretion. Okay. Commonly used expectorants are volatile oil, eucalyptus oil. These are direct expectorants. Iodide liquefy the mucus and adds its expulsion. Ammonium chloride and ammonium bicarbonate are reflex saline expectorants. These agents irritate gastric mucosa, and stimulate respiratory tract secretion. Okay, so what is the work of these agents? They irritate the gastric mucosa and stimulate respiratory tract secretion. So this is the mechanism of action in case of wet cough and in case of dry cough. So in wet cough, uh, uh, that is a reflex process and important for clear of airways. But in dry cough, that is not easily removed. So uh, they the expectorants generally produce response on the gastric mucosa, and that produce the respiratory tract secretion. Okay, so commonly used expectorants we already discussed. First one is potassium iodide. So the potassium iodide, the molecular formula of potassium iodide is Ki, that is also called otide, kali iodide. Standards contain not less than 99% potassium iodide calculated with the reference to a dried basis. So contain not less than 99% potassium iodide. So what is the mean of 99% potassium iodide? So uh, when take any solution or such type of medicament, then the purity has been counted and how much it is pure. That actually showing why this 99% potassium iodide. Physical properties: it is a white crystalline powder, odorless, bitter taste, soluble in water, soluble in glycerin, and soluble in alcohol. So this is the physical property. It is white crystalline powder, odorless, bitter taste, soluble in water, and also glycerin and alcohol. Next one is chemical properties. So what is the chemical properties of potassium iodide? So uh, 39 is the atomic mass, electronegativity 0.8, density 0.86 gram per cube centimeter at 0 degree centigrade, melting point 63.2 degree centigrade, boiling point 760, van der Waals radius 0.235, ionic radius 0.133, high isotopes it produces, and some other parameters that showing here. And method of preparation, it can be prepared by two methods. First one is laboratory method. So here uh, it can be prepared by treating slight excess of iodine with a hot aqueous solution of potassium hydroxide. So you can see the potassium hydroxide when reacted with excess amount of iodine. So the pale yellow solution obtained is evaporated to dryness. So pale yellow solution of potassium iodide is obtained, and here some other compounds are also formed, that is potassium iodate, and water is also removed. So this potassium iodate when heated with charcoal. So furthermore, this potassium iodate when heated with charcoal, so it produce further potassium iodide and carbon monoxide. So this is the laboratory method, and we can prepare the potassium iodide by the using of potassium hydroxide and excess amount of iodine. So here the important thing, we have to take excess amount of iodine. And furthermore, industrial method, that is on commercial scale, and potassium iodide can be prepared by using potassium carbonate and iron fillings. So potassium carbonate and iron fillings. So iron fillings are agitated in the iodine solution to form ferroferric iodide, FeI2, FeI3. So ferroferric iodide. So iron when reacted with iodine, then it form ferroferric iodide. And this ferric ferroiodide when reacted with potassium carbonate, so it produce potassium iodide. And other component are also produced ferric oxide and carbon dioxide. So industrial preparation we used in industrial preparation what we used iron filling that reacted with iodine, and in laboratory method we used potassium hydroxide that reacted with excess amount of iodine and that produced potassium iodide water. And when this potassium iodide reacted with uh, charcoal carbon, then it produced potassium iodide. And in industrial method, we already discussed that iron fillings reacted with iodine produce ferroferric iodide, and when this ferric ferroiodide reacted with potassium carbonate, then it produces potassium iodide. Uses, so it is used as a mild expectorant to treat of hypothyroidism. So it is used in the treatment of thyroidism, used as a source of iodine in cup preparation. It is also used in cup preparation to stabilize in preparation of solution of iodine. So it is also used in the preparation of solution of iodine because it also liberates the iodine. Storage, it should be stored in a well-closed container at a cool place. Incompatibility, so it is incompatible with salt of mercury, bismuth, lead, iron, oxidizing agent, and dilute hydrochloric acid. So these all agents showing incompatibility with potassium iodide. Doses 250 to 300 milligram daily. So this is the generally dose recommended for potassium iodide. Assay, this the assay based on oxidation reduction method using iodometric titration. So in oxidation reduction, we know one is oxidizing and second one is reducing agent. And through this iodometric generally used as a method in which iodine is relieved, and this relieved iodine treat when titrated with some specific reagent, sodium thiosulfate, then it produce the end point. So here the assay start with by using taking 0.5 gram of potassium iodide uh, is weighed and dissolved in a solution containing 10 ml of water. We add 30 ml of hydrochloric acid and 5 ml of chloroform. So that we taken in a conical flask. And when this solution is then titrated with 0.05 molar potassium iodide, then the purple color of iodine disappears. Uh, so this is a titrimetric method to determine the endpoint, and we also assay the potassium iodide concentration. So the last portion of the iodide solution is added dropwise while the solution is agitated continuously and vigorously. So this is the basic of titration in the endpoint. When the color change start, then we added in dog price the titrant, so we can easily determine the endpoint. It is then allowed to stand for 5 minutes. If any color in the chloroform layer, the titration is continued. So it is further allowed for 5 minute stand, and if any color in the chloroform layer is appear, then the titration is further continued. So and potassium iodide and HCl. So they form KCl, ICI, and H2O. Each 1 ml of 0.05 molar potassium iodide equivalent to 0.0166 milligram of potassium iodide. So this is the equivalent equation, and here we can determine the how much amount of potassium iodide required for potassium iodate required for potassium iodide. So this is a calculation which is based on the molarity. So we determine the molarity of potassium iodate and potassium iodide, and after calculating the equivalency of these compounds, then we determine this equation. Identification test. So add mercuric chloride solution to 1 ml of sample solution. A dark red precipitate is formed, which is slightly soluble in excess of this reagent and completely soluble in excess of potassium iodide. Solution by forming potassium mercuric iodide. So potassium iodide when reacted with mercurous chloride, then it forms mercurous iodide and potassium chloride. And potassium chloride, when reacted with mercurous iodide, then it forms potassium mercuric iodide. Test of purity. The sample is tested for the presence of following impurities, in which first is arsenic should not be more than 2 ppm, sulfate should not be more than 1 ppm, and iodide should be absent. So that is important. The iodide impurity should not be included in potassium iodide. So iron should not be more than 20 ppm. Heavy metals should not be more than 10 ppm. Loss on drying should not be more than 1%. So furthermore, purity also determined for clarity and color of the solution, and this is the method how can we determine the clarity and color of solution. So potassium iodide when dissolved in water, the solution should be clear and colorless. For alkali determination, dissolve the potassium iodide in freshly boiled and cooled water and add sulfuric acid and phenolphthalein. If no color develops, then alkali is sent. Chlorine, bromide, and thiosulfate is also determined. Then nitrate, nitrite, and ammonium determined. Can be determined cyanide, iodate, heavy metals, barium, sodium, arsenic. These all elements can be determined uh, for the purity of potassium iodide, for determination of purity of potassium iodide, and these can be found as the impurities in the final product. Next one is ammonium chloride. Ammonium chloride formula NH4Cl, molecular weight 53.49. It is colorless crystalline powder, cool saline test, hygroscopic in nature, freely soluble in water and in glycerin, and it is sparingly soluble in alcohol. It is also known as ammonium muriate. That is in the different form of ammonium chloride, here granular form and powder form. It is looking whitish. So method of preparation of ammonium chloride. So by neutralization reaction, evaporation to dryness. So it is a neutralization reaction where some uh, ammonia reacted with hydrochloric acid, that is form ammonium chloride. So these are the ionic solution ammonium chloride, and that purify by recatalyzation. So by neutralization reaction, we can produce ammonium chloride. It is produced by heating ammonium sulfate in sodium chloride. So ammonium chloride is also produced by heating ammonium sulfate in sodium chloride. So here we can get firstly ammonia, HCl, and sodium sulfate. Properties of ammonium chloride. So it is white colored, fine or coarse crystalline powder. It is cooling saline test, slightly hygroscopic, partially soluble in mixture of water and alcohol, really soluble in glycerine. 0.08% weight by volume of ammonium chloride is isotonic with serum. Freshly prepared aqueous solution are neutral to litmus, but becomes quickly acidic on standing because of hydrolysis. So ammonium chloride freshly prepared solution, it is neutral for the litmus paper. So neutral means it's showing pH about 7, but becomes quickly acidic on standing because of hydrolysis. Identification test. So it include acidity testing, color of methyl red, methyl red indicator according to change of pH. Dissolve 1 gram of ammonium chloride in 10 ml distilled water. Add few drops of methyl red indicator and observe the color change. So this is the identification test. And assay, how can we perform the assay of ammonium chloride? So weigh accurately about 3 gram of ammonium chloride that is previously dried and dissolve in water to make exactly 250 ml. Then measure exactly 25 ml of this solution, add 10 ml of sodium hydroxide and immediately equipped with a distillation apparatus connected to receiver containing 40 ml of 0.1 molar sulfuric acid, heated to distill the ammonia into sulfuric acid and titrate the excess sulfuric acid with 0.2 mole per liter sodium hydroxide by using methyl red as indicator. So 1 ml of 0.1 molar per liter sulfuric acid is equal to uh, milligram of ammonium chloride. So we can determine the 0.05349 gram of ammonium chloride. The neutral second assay method is the neutral formaldehyde solution is added so that ammonium chloride will be converted to methanamide and hydrochloric acid. The liberated acid is titrated with ammonium chloride when reacted with formaldehyde, then it forms uh, CH2, NH, and HCl and H2O. And when this titrated with sodium hydroxide using phenolphthalein as indicator, then we determine the endpoint. So each 1 ml of 0.1 normal sodium hydroxide equivalent to 0.05349 gram of ammonium chloride. So here one other method we used, that is Bollard method, is solution of the substance acidify with nitric acid and shaken with a measured volume of NY10 silver nitrate. Nitrobenzene being also added in the solution. So nitrobenzene is added to coagulate the precipitate of silver chloride, so that it will not interfere with the titration later of excess of silver nitrate. So by using this titration, we determine the ammonium chloride. There is some identification test. So it gives a reaction of ammonium salt and of chloride. So here, a few gram of substance is heated with sodium hydroxide solution, leading to the evaluation of ammonia gas, which is recognizable by its color and by its action on moist red litmus paper. So ammonium chloride reacted with hydroxide and it forms ammonia and H2O. So there are tests of purity and uses. So it acts as a mild expectorant diaphoretic when administered into small doses. It does so due to local irritation, which produce increasing secretion of acid. respiratory tract. So, what is the work of expectorant? It already discussed. So, it is all used of ammonium chloride. So now I am completing my expectorant part, and uh, later we will discuss the emetic and hematinic part. So now I convey my lecture to Miss Aveline Kaur. He is a professor of pharmaceutical chemistry and will give the next lecture. Okay, thank you.
A very good evening to everyone. Myself Pavleen Kaur, and I'm before you to present my second session. So my second session is on the topic cell division and cell junction. So, what is cell division? In this topic, we will discuss about the division